Did you know, just by looking at the bones of a dead infant, a forensic expert can tell exactly how many months old that child was? And in a court of law, that single piece of information can completely change the verdict of a murder case. Welcome back to the channel. Today, we are going to cover one of the most fascinating and high-yield topics in forensic medicine: fetal autopsy and the complete scientific technique of child age determination. This topic is extremely important for your university exams, professional exams, and also for your clinical understanding. So make sure you watch this video till the very end, because I have included a quick revision section at the end that will help you remember everything within minutes. Let's get started. A fetal autopsy is a systematic scientific examination of a dead fetus or a newborn infant, performed to determine the cause of death, the age of the fetus, and other important medico-legal facts. Now, why is this autopsy performed? There are three major reasons. Number one, to determine the cause of death. Was the death natural? Was it due to birth injury? Or was there foul play involved? Number two, to determine whether the child was stillborn or live-born. This is extremely important in criminal cases, especially in cases of infanticide. Number three, to determine the gestational age, maturity, and viability of the fetus. All three of these have direct medico-legal significance, and we will discuss each one in detail. Now, one of the most critical questions in fetal autopsy is this: was this child born alive, or was it already dead before birth? This question is the foundation of every infanticide case. To answer this question, the most important test we use is called the hydrostatic test, also known as the lung float test. Let me explain how it works. After death, the lungs are carefully removed from the body. They are then placed in a container of water. Now, if the lungs float, it means the child breathed after birth, because when a child takes its first breath, air enters the lungs, and that air makes the lungs less dense than water, causing them to float. On the other hand, if the lungs sink, it means the child never took a breath and was therefore stillborn. This is because in a stillborn child, no air has entered the lungs, so the lungs remain dense and heavy, and they sink to the bottom. However, there is one important limitation you must remember. If putrefaction has already begun, meaning the body has started to decompose, gases produced by bacteria can also make the lungs float even in a stillborn child. So in such cases, the hydrostatic test alone is not reliable and must be combined with other findings. Apart from the lung float test, we also look for other signs of live birth, such as food in the stomach, which indicates the child was fed after birth, and changes in the umbilical cord, which indicate the child survived for some time after delivery. Now let's move to the main topic. How do we determine the age of a fetus? There are four major methods used in forensic medicine. Method number one, length or crown heel length. Method number two, weight of the fetus. Method number three, ossification sensors. Method number four, external features or physical characteristics. Let's go through each one of these in detail. The first method is length, and to calculate age from length, we use the famous Haase's rule. This is one of the most commonly asked questions in exams, so pay close attention. Haase's rule states, for the first 5 months of pregnancy, the length of the fetus in centimeters equals the square of the month number. Let me give you examples. At 2 months, length equals 2 times 2 equals 4 centimeters. At 3 months, length equals 3 times 3 equals 9 centimeters. At 4 months, length equals 4 times 4 equals 16 centimeters. At 5 months, length equals 5 times 5 equals 25 centimeters. Now, after the 5th month, the rule changes. For months 6 to 10, the length in centimeters equals the month number multiplied by 5. So at 6 months, length equals 6 times 5 equals 30 centimeters. At 7 months, length equals 7 times 5 equals 35 centimeters. At 8 months, length equals 8 times 5 equals 40 centimeters. At 9 months, length equals 9 times 5 equals 45 centimeters. At 10 months, length equals 10 times 5 equals 50 centimeters. So to summarize Haase's rule, first 5 months, square the month number. After 5 months, multiply the month number by 5. Simple, clean, and highly effective. The second method is weight. Here are the standard weight milestones you need to remember. At 5 months, the fetus weighs approximately 300 grams. At 6 months, approximately 600 to 700 grams. At 7 months, approximately 1,000 grams or 1 kilogram. At 8 months, approximately 1,500 to 1,700 grams. At 9 months, approximately 2,500 to 3,000 grams. A full-term baby at 10 months weighs approximately 3,000 to 3,500 grams. Now, weight alone is not always reliable because it can be affected by nutrition, disease, and other factors. That is why we always combine weight with other methods, especially ossification centers. Now we come to the most reliable and forensically significant method, ossification centers. What is ossification? Ossification is the process by which cartilage is gradually converted into bone. During fetal development, specific bones begin to ossify at specific times, and this pattern is predictable and consistent. That is why by identifying which bones have started ossifying, a forensic expert can accurately estimate the age of the fetus. Let me walk you through the most important ossification centers. At 2 months, ossification begins in the clavicle. This is actually the first bone in the entire body to ossify. At 3 months, ossification begins in the vertebrae and long bones of the limbs. At 4 months, ossification is visible in most of the long bones. At 5 months, the calcaneus, which is the heel bone, begins to ossify. At 8 months, the talus begins to ossify. At 9 months, the lower end of the femur begins to ossify. This is the single most important ossification sensor in forensic medicine. Why? Because the appearance of the ossification sensor at the lower end of the femur indicates that the fetus has reached full term. In other words, if this sensor is present, the fetus was at least 9 months old. This is called the Bellantine sign, or simply the full-term sign. At birth, 2 additional sensors appear, the upper end of the tibia and the cuboid bone of the foot. So remember, calcaneus, 7th month, talus, 8th month, lower end of femur, 9th month, full-term indicator, upper tibia and cuboid at birth. The fourth method is external features, and this method gives us a quick visual estimation of gestational age. Let me go through the key features month by month. At 4 months, the sex of the fetus becomes externally distinguishable. At 5 months, lanugo appears, which is fine, soft hair that covers the entire body of the fetus. At 6 months, the eyelids separate and become distinct. Vernus cassosa also appears at this stage. This is white, cheese-like protective coating that covers the skin of the fetus. At 7 months, the pupillary membrane disappears, allowing the eyes to open. The testes begin to descend, and at this stage, they are located in the inguinal canal. At 8 months, subcutaneous fat begins to accumulate, making the skin look smoother and less wrinkled. The lanugo begins to disappear from the face. At 9 months, this is the full-term stage, and several important features appear together. The testes have fully descended into the scrotum. In female fetuses, the labia majora now completely covers the labia minora. The nails reach the tips of the fingers. The lanugo has almost completely disappeared from the body. The skin is smooth, plump, and covered with Vernus cassosa. These external features, when combined with length, weight, and ossification, give a very accurate estimation of gestational age. Now, let's talk about viability, because this is a concept that has major medical-legal importance. Viability means the ability of a fetus to survive independently outside the mother's womb. In classical forensic medicine, a fetus is considered viable after 28 weeks of gestation. At 28 weeks, the fetus weighs approximately 1,000 grams and is about 35 centimeters in length. However, with modern neonatal intensive care, premature babies as young as 22 to 24 weeks have survived. So in medical-legal practice, the traditional benchmark of 28 weeks is still used unless there is specific evidence to the contrary. Why does viability matter in court? Because in cases of alleged infanticide, if the fetus was not viable, meaning it could not have survived outside the womb regardless, then the charge of causing death after birth cannot apply. Now, let's bring everything together and understand the medical-legal importance of fetal autopsy. Number 1, infanticide cases. Fetal autopsy helps determine whether the child was born alive and whether the death was caused by deliberate action. Number 2, illegal abortion cases. The age and viability of the fetus helps establish whether an illegal termination of pregnancy was performed. Number 3, insurance and inheritance claims. Sometimes the age of a stillborn child needs to be legally established for insurance or legal inheritance purposes. Number 4, establishing cause of death. The autopsy can reveal whether death was due to birth asphyxia, trauma, congenital abnormality, or criminal action. Number 5, determining gestational age in legal proceedings. Courts often require accurate scientific evidence of gestational age, and ossification centers provide the most reliable proof.